Your back pain isn't a spine problem, and fixing it is easier than you think. I'm going to show you 5 mistakes you're making that are keeping your back pain active. Most people with chronic back pain are treating it completely backwards. They're doing things their doctors tell them to do that actually make the problem worse. I've spent 15 years treating patients with back pain, and I can tell you that 90% of chronic back pain has nothing to do with your spine. Today, I'm going to reveal what's really causing your pain and exactly how to fix it. Let me ask you something. Have you been told you have a bulging disc, degenerative disc disease, arthritis in your spine? Maybe you've had an MRI that showed abnormalities, and your doctor told you that's why your back hurts. What if I told you that most people with bulging discs have no pain at all? That the abnormalities on your MRI are probably not the reason you're hurting? What if your back pain is actually coming from 5 specific mistakes you're making every single day? I'm going to prove it to you, and I'm going to show you how to fix each one. Here's what frustrates me about how we treat back pain in this country. Someone develops back pain. They go to their doctor. They get an MRI. The MRI shows some disc degeneration or a small bulge. The doctor says, "That's your problem." They prescribe pain medication, muscle relaxers, and rest. The patient rests, takes the medication, the pain persists. They go back. The doctor refers them to physical therapy. They do some generic stretches and exercises. The pain continues. Eventually, someone mentions surgery, but nobody asks why the back pain started in the first place. Nobody addresses the root cause. And the root cause is almost never what's on the MRI. And here's what concerns me. Chronic back pain destroys quality of life. It limits your activities. It disrupts your sleep. It causes depression and anxiety. It leads to medication dependence. It can progress to the point where you can't work, can't play with your kids, can't do the things you love. Think about the next 5 years if your back pain continues. Every morning waking up stiff and hurting. Every activity limited by fear of making it worse. Missing out on travel, sports, playing with grandchildren. That's not the life you deserve. Let's fix this right now. Mistake number 1, you're sitting too much. The biggest mistake people make with back pain is sitting for extended periods. Sitting is destroying your back, and most people with back pain sit for 8 to 12 hours every day. Here's what happens when you sit. Your hip flexors, the muscles at the front of your hips, become short and tight. When these muscles tighten, they pull your pelvis forward. This increases the curve in your lower back, a condition called hyperlordosis. This excessive curve compresses the joints and discs in your lower back. Pain follows. Additionally, when you sit, your glutes, your hip extensors, become weak and inactive. Your glutes are supposed to support your pelvis and take pressure off your lower back. But when they're weak, your lower back has to do all the work. It becomes overloaded. The muscles spasm. The joints compress. You develop chronic pain. The research is clear. People who sit more than 6 hours daily have 3 times the risk of developing chronic back pain compared to those who sit less than 4 hours. And once you have back pain, continued sitting perpetuates it. But most people with back pain continue sitting all day. They sit at work, they sit in the car, they sit at home. Their hip flexors stay tight, their glutes stay weak, their back pain stays active. I had a patient, Stephen, 48 years old, who'd had lower back pain for 3 years. He'd tried physical therapy, chiropractic, massage, acupuncture. Nothing helped. He worked a desk job, sat 9 hours daily. When I assessed him, his hip flexors were severely tight and his glutes barely activated. His lower back was doing all the work of stabilizing his pelvis. We didn't do any back exercises. We focused entirely on breaking up his sitting. Every 30 minutes, he stood up and walked for 2 minutes. We added hip flexor stretches 3 times daily. We activated his glutes with targeted exercises. Within 2 weeks, his pain decreased by 40%. Within 6 weeks, he was pain-free for the first time in 3 years. Your action step: for the next 30 days, never sit for more than 30 minutes without standing and moving for at least 2 minutes. Set a timer. This is non-negotiable. When you stand, do this: hip flexor stretch. Step 1 foot forward into a lunge position. Push your hips forward. Hold for 30 seconds each side, then activate your glutes. Squeeze them hard for 10 seconds. Release. Repeat 5 times. Do this every 30 minutes when you're sitting. Your hip flexors will loosen. Your glutes will activate. Your lower back will decompress. Your pain will decrease dramatically. This single change eliminates back pain in 30 to 40% of my patients. It's that powerful. Mistake number 2: you have weak core muscles. The second massive mistake is having a weak core. Your core muscles are supposed to stabilize your spine. When they're weak, your spine becomes unstable. Every movement creates excessive motion in your vertebrae. Your back muscles have to overwork to compensate. They fatigue, they spasm, you develop pain. But here's what most people get wrong about core training. They think core means abs. They do crunches and sit-ups. This doesn't help back pain. In fact, it often makes it worse. Crunches load your spine in flexion, which is exactly the position that causes disc problems. The core muscles that matter for back pain are your deep stabilizers, your transverse abdominis, your multifidus, your pelvic floor. These muscles create intra-abdominal pressure that supports your spine like a natural weight belt. When these muscles work properly, your spine is stable and protected. But in most people with back pain, these muscles are inhibited. They don't activate properly. The spine loses its internal support system. The superficial muscles try to compensate, but they can't do the job effectively. The spine remains unstable. Pain persists. Studies show that people with chronic back pain have 30 to 40% weaker, deep core muscles compared to people without pain. Strengthening these specific muscles resolves back pain in 70% of cases. I worked with a woman, Barbara, 52, whose back pain had persisted for 5 years. She'd tried everything. She did crunches daily thinking she was strengthening her core, but her pain continued. When I tested her deep core activation, it was almost non-existent. Her transverse abdominis wasn't firing. Her multifidus was atrophied. We stopped the crunches completely. We focused on deep core activation exercises, dead bugs, bird dogs, planks with proper breathing. Within 3 weeks, she could feel her deep core engaging for the first time. Within 8 weeks, her back pain was reduced by 70%. Within 12 weeks, completely resolved. Your action step: learn to activate your deep core properly. Here's the exercise that works best. Dead bugs. Lie on your back. Knees bent 90 degrees, shins parallel to the floor. Arms straight up toward the ceiling. Take a deep breath. As you exhale, draw your belly button towards your spine. This activates your transverse abdominis. Hold that engagement. Now slowly lower your right arm overhead while straightening your left leg. Keep your lower back pressed flat to the floor. Don't let it arch. Return to start. Repeat on the opposite side. That's 1 rep. Do 3 sets of 10 reps daily. Focus on maintaining that deep core engagement the entire time. Within 2 weeks, you'll feel your core working properly. Within 4 weeks, your back will feel more stable. Within 8 weeks, your pain will significantly decrease. Mistake number 3, you're too stiff in the wrong places. The third mistake is mobility imbalance. Most people with back pain are stiff in their thoracic spine and hips, but hypermobile in their lower back. This is exactly backwards from what you need. Your thoracic spine, your mid-back, is designed for rotation and extension. Your hips are designed for flexion, extension, and rotation. But in most people, these areas become stiff and immobile. When you try to move, your body has to get that motion from somewhere. It comes from your lower back. Your lower back, your lumbar spine, is designed primarily for stability, not mobility. It should move some, but not excessively. But when your thoracic spine and hips are stiff, your lower back has to compensate by moving too much. This excessive motion damages the discs, strains the ligaments, and fatigues the muscles. Pain develops. I see this pattern constantly. Someone bends forward to pick something up. Their hips are too stiff to hinge properly. Their thoracic spine is too stiff to flex. So all the motion comes from their lower back. It bends excessively. The disc gets compressed asymmetrically. Pain follows. The solution is improving mobility where you're stiff and creating stability where you're hypermobile. But most people do generic stretches that don't address the specific areas that need work. I had a patient, David, 44, who couldn't bend forward without severe back pain. His hamstrings were flexible, his lower back was very flexible, but his hips barely moved and his thoracic spine was locked up. Every time he bent forward, all the motion came from his lower back. It was grinding his discs. We focused on hip mobility and thoracic spine mobility exclusively. Hip flexor stretches, hip rotations, thoracic extensions over a foam roller. We didn't stretch his lower back at all. Within 3 weeks, he could touch his toes without pain for the first time in 2 years. Within 2 months, his back pain was 90% resolved. Your action step: mobilize your thoracic spine and hips daily. Here are the 2 exercises you need. Thoracic extension. Get a foam roller. Lie on your back with the roller under your mid-back. Support your head with your hands. Arch backwards over the roller. Hold for 5 breaths. Move the roller up 2 inches. Repeat. Do this for your entire mid-back. 3 minutes daily. Hip 90-90 stretch. Sit on the floor. Right leg bent 90 degrees in front. Left leg bent 90 degrees behind. Keep your spine tall. Lean forward over your front leg. Hold 60 seconds. Switch sides. Do this twice daily. Within 2 weeks, you'll notice improved mobility in these areas. Within 4 weeks, your back will move less and feel better. Within 8 weeks, significant pain reduction. Mistake number 4. You're afraid to move. The 4th mistake is kinesiophobia, fear of movement. This is one of the most damaging factors in chronic back pain, and most people don't even realize they have it. When you develop back pain, your brain creates an association between certain movements and pain. Bending forward hurt, so your brain learns that bending is dangerous. Twisting hurt, so twisting becomes threatening. Lifting hurt, so lifting becomes something to avoid. Over time you move less, you avoid activities, you become deconditioned, your muscles weaken, your spine loses tolerance for normal loads. And paradoxically, this makes your back more vulnerable and more painful. The research shows that fear of movement is a stronger predictor of chronic back pain than the actual structural damage in your spine. People with high fear avoidance have twice the disability and 3 times the pain compared to people with low fear avoidance, even when their MRI findings are identical. But the medical system reinforces this fear. You get an MRI. The report lists all the degenerative changes. Your doctor tells you to avoid certain activities. You start believing your back is fragile. You move less. You become more disabled. The pain worsens. The truth is, your back is strong. It's designed to move. It's designed to load. The degenerative changes on your MRI are normal aging, like wrinkles on your face. They're not the reason you hurt. And avoiding movement makes everything worse. I worked with a man, George, 59, who was terrified to bend over. He'd been told he had severe degenerative disc disease. He bent at the knees for everything, keeping his back rigid. He avoided all lifting, he barely exercised. He was becoming increasingly disabled. We gradually reintroduced movement, started with small, controlled bends. No weight, just movement. His back didn't explode, the pain didn't increase. We progressively added load. Within 2 months he was bending normally. Within 4 months he was lifting weights again. His pain decreased by 60%. His fear disappeared, his function returned. Your action step: start moving your back again, gradually and progressively but consistently. Every morning, do this. Stand. Bend forward as far as you comfortably can. Don't push into severe pain, but gentle discomfort is okay. Hold for 5 breaths. Come back up. Repeat 10 times. Each day try to go slightly further. Your brain needs to learn that movement is safe. Your tissues need to adapt to load. Within 2 weeks, your range will improve. Within 4 weeks, your fear will decrease. Within 8 weeks, your back will tolerate much more activity with much less pain. Mistake number 5. Your sleep position is destroying your back. The 5th mistake is sleeping in positions that stress your spine all night long. You spend 6 to 8 hours in bed. If your sleeping position is bad, you're loading your spine incorrectly for hours while you're unconscious. You wake up stiff and painful. The cycle continues. The worst position for your back is stomach sleeping. When you sleep on your stomach, your neck is rotated to one side for hours. Your lower back is forced into extension. This compresses your facet joints and can irritate your discs. People who sleep on their stomachs have significantly higher rates of chronic back and neck pain. The second worst position is side sleeping with poor alignment. If your top leg drops forward and rotates your pelvis, this twists your lower back all night. Or if your mattress is too soft and your spine sags sideways, this creates lateral compression. The best position for most people with back pain is side sleeping with proper support, or back sleeping with knees elevated. These positions maintain neutral spine alignment and distribute pressure evenly. But most people have slept the same way for decades. They don't realize their sleep position is perpetuating their pain. Every night they load their spine incorrectly. Every morning they wake up hurting. They think it's just how mornings are. It's not. It's their sleep position. I had a patient, Jennifer, 51, who woke up every single morning with severe lower back pain. It took her an hour to loosen up. During the day her pain was moderate, but mornings were terrible. She slept on her stomach and had for 30 years. We changed her sleep position. Side sleeping with a pillow between her knees to keep her pelvis aligned. It took 2 weeks to adjust to the new position. But after that adjustment period, her morning pain decreased by 70%. Within 1 month, she was waking up with minimal pain. Within 2 months, pain-free mornings. Her daytime pain improved dramatically because she wasn't starting every day, already inflamed. Your action step: fix your sleep position tonight. If you're a stomach sleeper, you must change. Start with side sleeping. Here's how. Lie on your side. Place a pillow between your knees. This keeps your pelvis and spine aligned. Make sure your head is properly supported so your neck stays neutral. Pull a body pillow against your chest for additional support. If you prefer back sleeping, lie on your back with a pillow under your knees. This flattens your lower back slightly and reduces compression on your joints. It will feel awkward for 1 to 2 weeks. Push through. After the adjustment period, your morning stiffness will dramatically decrease. Your overall pain will improve because you're no longer inflaming your back every single night. The transformation. Now let me tell you what happens when you fix all 5 mistakes for the next 8 weeks. Week 1, you break up prolonged sitting. You stretch your hip flexors and activate your glutes every 30 minutes. Your lower back feels less compressed by the end of each day. Week 2, you start dead bug exercises to activate your deep core. You begin mobilizing your thoracic spine and hips. Your back feels more stable. Your range of motion improves. Week 3, you're gradually reintroducing movement. Your fear is decreasing. You're bending and lifting with more confidence. You change your sleep position. Your morning stiffness is improving. Week 4, all 5 corrections are now habits. Your pain has decreased by 30 to 40%. You're moving better, sleeping better, functioning better. Week 6, your core is noticeably stronger. Your mobility is significantly improved. You've overcome your movement fear. Your sleep position is comfortable now. Your pain is down 60 to 70% from baseline. Week 8, your back pain is minimal or completely resolved. You're doing activities you couldn't do 2 months ago. You understand what was causing your pain and how to prevent it from returning. You're back in control of your life. This is what I've seen happen thousands of times. Not with injections, not with surgery, not with pain medication. With 5 simple corrections that address the actual causes of back pain. Final thoughts. I want you to imagine something with me. It's 2 years from now. You never corrected these 5 mistakes. You kept sitting all day. Your core stayed weak. You remained stiff in the wrong places. You continued avoiding movement out of fear. You kept sleeping in a position that stressed your spine. Where is your back pain now? It's progressed. You're more limited. You've tried injections, maybe surgery. The pain persists. You're on chronic pain medication. You've stopped doing activities you love. Your quality of life has deteriorated. Your back pain controls your life. Now imagine the alternative. You started today. You fixed these 5 mistakes. You stayed consistent. It's 2 years later, and your back has been pain-free for over a year. You move confidently. You sleep well. You do everything you want to do. You're not limited. You're not afraid. You're free. Which future do you want? The choice is entirely yours. I've given you the exact corrections that have eliminated back pain in thousands of my patients. They're simple, they're effective, they work, but none of that matters if you don't implement them. So here's what I want you to do right now, before this video ends. Choose one mistake to fix. Just one. Start today. Maybe you set a timer right now to stand every 30 minutes. Maybe you do your first set of dead bugs today. Maybe you order a foam roller to start mobilizing your thoracic spine. Maybe you commit to bending forward 10 times tomorrow morning. Maybe you change your sleep position tonight. Pick one. Start there. Add the others over the next 2 weeks. Your back can heal. I've seen it too many times to doubt it. But your spine needs you to stop making these 5 mistakes. And that stops right now. If this video helped you, share it with someone who needs it. There are millions of people with chronic back pain who've been told their spine is the problem. Show them the real causes. And if you want more strategies like this, evidence-based medicine that actually addresses root causes, subscribe to this channel. I post new videos every week. Your spine carried you this far. Now it's your turn to take care of it.